In this video, we are going to share with you the 4 most important feeding related things that every parent should take care of.
Right.
They are really the basis if you want to make sure that your baby grows and gains weight, because they help your baby receive enough calories and nutrients.
Yes. Sometimes though, there can be problems which prevent your baby from growing as expected. And so in the second part of this video, we are going to discuss what those 5 problems are and how to deal with them.
Yes, and then at the end of this video, we are also going to share with you an acupressure-based baby massage treatment that could help you increase your baby's weight, as many scientific studies have shown.
Right.
This is Nathalie, a pregnancy and birth consultant and TCM therapist.
And that's Mathias, the researcher and Science Geek, and we are here to help you and your baby naturally and science-based.
So let's help your baby grow. Alright, so let's first discuss the 4 most basic feeding related things that you should take care of in order to make sure that your baby receives all the calories and nutrients that your baby needs.
If you are breastfeeding, the most important thing to do to help your baby grow is making sure that your baby is correctly latched on your breast. If the latch is poor, your baby will not be able to efficiently remove breast milk from your breast.
Yeah.
As a result, they get tired and stop nursing before the hunger is satisfied.
Yes, the most important signs of a good latch are when your baby's mouth is wide open when he drinks, when his mouth covers more areola near his lower jaw, and when you can see more areola above his lips. And of course, another important sign is when you can hear him swallow, right?
And finally, if you're bottle feeding, please make sure that you're using the right teats.
Yes, teats for newborns are different than teats for older babies in terms of how much milk they let through the opening. So if you're feeding an older baby with a teat intended for younger babies, your baby will not be able to efficiently remove milk from the bottle.
Right.
As a result, they get tired and stop nursing before the hunger is satisfied.
When you breastfeed, your baby needs to nurse for a certain amount of time on each side in order to receive all the calories that baby needs. Among others, that's because the first milk that your baby receives when the baby starts nursing is the so-called fore-milk. And after some time on the same breast, the so-called hind milk starts to flow. And that milk contains more fat than the fore-milk, which is why it contains much more calories. And it's that milk which makes your baby full and helps your baby grow.
Yeah.
And because of that, you have to give your baby the time baby needs to get more of the nutritious hind milk.
Yes. Now, unfortunately, experts don't agree at all on how long a baby should nurse on each side.
Right.
And so a better approach is to look for cues that your baby is full. The most important cues are when baby comes off by himself, does not actively suck anymore, or is simply looking satisfied, right? And only then would you offer the second breast, no matter if they take it or not.
Right.
Finally, keep in mind that the older your baby gets, the less time they need to get the required calories.
If you want to make sure that your baby grows and gains weight, then you have to feed your baby in certain frequencies.
Yeah.
Initially, that frequency obviously needs to be higher because newborns only have a very small stomach. As a result, they cannot really get lots of calories with each feed. Eventually though, you can space out the feedings because your baby will be able to get more calories with each feeding.
Yes, so this table shows you the approximate frequency of the feedings depending on age, is recommended by the American Academy of Pediatrics. And it basically reflects what Nathalie just said, that the younger the baby, the higher the frequency of the feeding. By the way, you can also find this table in the description below this video. When producing breast milk, your body takes nutrients from your own nutrient reserves. So even if you don't provide your body with the nutrients that it needs, your body is still able to produce a nutrient-rich breast milk for your baby. The problem is though that once your nutrient reserves are depleted, your body is no longer able to do that. And when that's the case, your baby will no longer receive a nutrient-rich milk, which could have an impact on their growth.
Right. Therefore, it is really important that you constantly fill up your own nutrient reserve.
Yeah.
If you want to know how, check out the video about breastfeeding diets, which you can find in the description below this video.
Okay, so if you take care of all the things that we just mentioned, then feeding-wise, you have laid the foundation so that your baby is able to grow.
Right.
However, sometimes it can happen that you take care of all those things, but your baby is still not growing. When that's the case, it is normally because of factors which prevent your baby from growing. So let's look into these.
Whenever a baby is not consistently gaining weight and growing as expected, the first step should always be a checkup by a pediatrician. And that's because in very rare cases, there can be medical reasons why a baby is not gaining enough weight or even loses weight.
Yeah.
Examples can be jaundice, an illness, or an infection.
Yes, it is important to eliminate those problems first, because if such problems prevent your baby from growing, then whatever else you're doing to help your baby grow is unlikely to work, right? So again, the first step should be a checkup.
Next to medical problems, there can also be other things which bother your baby and prevent them from gaining weight. In fact, what we often observe is that new moms who had a difficult birth often struggle with the feedings, no matter if breast or bottle feeding, and sometimes those babies don't gain weight as expected.
Yeah.
And one thing that has really helped lots of them with their feeding problems is taking the baby to a chiropractor.
Yes, in fact, we always recommend taking a baby to a chiropractor for a checkup sometime after birth, just to make sure that anything that happened during the delivery does not cause any problems in the long run,
right.
Particularly if you had an assisted delivery, right? And so, as Nathalie just mentioned, sometimes this can be enough to improve any feeding-related problems and to help the baby gain weight. Another important reason why babies often don't gain weight as expected are non-medical gastrointestinal issues, such as abdominal pain, bloating, mild forms of reflux, or spit up.
Right.
Because then they tend to eat less or spit part of it up again, and as a result, they receive less calories, right? When that's the case, the first step should always be to correctly burp your baby in order to get rid of excess air.
Yes. On top of that, please make sure that you feed your baby in the right position, because not every feeding position is ideal for gastrointestinal issues.
Yeah.
We talk more about burping and feeding positions in other videos, which you can find in the description below this video. And finally, another thing which could also help is the treatment that we show you in just a minute. So please bear with us.
To be honest with you, in most cases, a low breast milk supply is more a perceived problem rather than an actual one, but it does happen to some women.
Right.
And whenever that's the case, it could be that your baby does not receive enough milk and calories.
Yes. So if your baby is not looking happy after the feed most of the times, and most importantly, if you don't see at least 6 to 8 wet diapers per day once your milk has come in, then milk supply could be a problem if the latch is correct. But it's always good to have your provider confirm just that, and also to exclude other problems such as medications or an illness.
Yes. And finally, if your milk supply is low, then try our natural ways to increase your breast milk supply, which you can find in the description below this video.
Obviously, many things which we have mentioned so far can lead to poor appetite in babies. However, sometimes we also meet babies who are perfectly well and also happy, but they just don't eat a lot and therefore don't gain the weight they're supposed to.
Yeah.
Whenever that's the case, we look at the problem from an alternative medicine point of view. And so if your baby does not eat a lot, has a pale complexion, or is rather sleepy, spits up a lot or gets nauseous when driving in a car, then these are normally signs that point to spleen-related problems.
Yes, in the description below this video, we explain why the spleen is so important for those of you who are interested, right? However, the key here is that we can address problems related to the spleen with the help of acupressure that we combine with a baby massage treatment.
Right.
The reason why we do that is because there are quite some scientific studies which have shown that massage treatments can have a very positive effect on baby's weight gain, particularly when combined with acupressure.
Right.
And so Nathalie does this very often at the clinic to help parents support their baby's weight gain.
Right.
So let's have a look at how to do that.
Put some oil on your hands and rub your hands so that both your hands and the oil get warm. Place your hands on her belly and move upwards to her shoulders. From there, move downwards from her shoulders all the way down to her hands. Go back to her shoulders without touching her and then stroke downwards over her abdomen and eventually over her legs down to her feet. Do this 3 times. Next, focus on your baby's belly. This step is quite easy. Simply apply circular movements clockwise around her belly button for about 5 seconds. Next, focus on the baby's right arm. Start on the baby's shoulder and use your thumb to apply circular movements while moving downwards on the outside of the baby's arm, all the way down to her hand. Do this 3 times while applying gentle pressure. Next, find the fold that appears when you bend your baby's hand. That fold can be found right where the wrist ends and the palm begins. Then find the midpoint of your baby's wrist right on that fold. Gently press and massage the point with either your thumb or index finger for about 10 seconds. Finish this treatment by gently stroking downwards from her shoulder all the way down to her hand. Once you're done with the right arm, do exactly the same on the left arm of the baby. Next, focus on the baby's right leg. Start with the baby's thigh on the outside of her leg and use your thumb to apply circular movements while going all the way down to her ankle. Do this 3 times while applying gentle pressure. Next, work your way upwards along the baby's right leg, starting with her ankle. But this time work on the inside of her leg. You can either apply the same circular movements as before, or simply apply gentle pressure with your thumb while going all the way up from her ankle to her thigh, just as I'm doing it here. Do this 3 times. Next, take the width of 4 of your baby's fingers. Then place that width right below the lower border of your baby's kneecap on the outside of the shin. The point you're looking for is located at the end of that short distance below your baby's kneecap right next to the shin. Gently press and massage the point with either your thumb or index finger for about 10 seconds. Next, stay on the exact same foot. Slide with your finger from your baby's big toe along the side of the foot until you feel a bony prominence. Right after the bony prominence, there is a little depression. The point you're looking for is located in that depression. Gently press and massage the point with either your thumb or index finger for about 10 seconds. Finish this treatment by gently stroking downwards from the baby's thigh all the way down to her ankle. Do this on the outside as well as on the inside of her leg. Once you're done with the right leg, do exactly the same on the left leg of the baby.
Okay, that wasn't too difficult, right? We do hope that you found this video helpful. If you did, we would be super grateful if you could leave us a like.
Yes, and for more videos on pregnancy and baby related topics in the near future, subscribe to our channel and hit the bell.